Hey guys, Sabrina here, licensed massage therapist and certified cosmetic surgery specialist. And if you are someone who has been thinking about getting plastic surgery or already had plastic surgery and they're considering getting a different type of plastic surgery, these are the different types of plastic surgeries you could get. All right. Boobies! So when it comes to boobs, there's so many different types of avenues that you can take, and I'm a certified breast massage therapist, so I've worked with all different types of boobs. So now let's just start with plain implants. So a lot of surgeons, they will just cut underneath the breasts, stick in an implant in there, and give you the nice cleavage that you want. Whether you want to be an exaggerated cleavage or you just want to look natural. Totally up to you and your surgeon, but those are generally, they'll go in through here unless they go through your armpit. I've had a few girls that they go through the armpit and then they stick the implant in through the armpit, and it actually, I've noticed, has made the breast go up like this, and they have more cleavage. I do like that look. However, and from what I've learned, you have to think about, you can't really lift your arms up too high. I mean, with any breast surgery, you're only localized to here for like 2 weeks, 2 to 3 weeks, depending on how fast you heal and how fast we get the inflammation down. But scar tissue changes, hair follicle growth. So if you are going through your armpit, there could be a chance of you getting ingrown hairs, especially because the hair follicle growth can either go away completely because scar tissue changes that, or when you get the ingrown hairs in there, I've seen it, it's painful, and that's a whole other issue in itself. Consult your surgeon if that does happen. But I have seen the look, and I do love the way that they look. Now, if you are a big breast woman and you need to get, and you want to get a reduction. So when it comes to reducing breasts and you have a lot of skin and you have a lot of breast tissue, you're going to need a lift and a reduction. So with that, they'll generally do the T-shaped or anchor-shaped incisions underneath the nipples and around the breast to help lift the breast, and then they'll cut the excess skin to the breast size that you want and that you consult with your surgeon. Now, if you're getting a breast reduction, I don't really see any other way not to get the anchored incision because you're getting skin removal. Now, same thing with a breast lift. If you're getting a breast lift done, they have to lift the girls, so they have to do the anchor shaped and then all of that jazz. And so now going over the different types of implants, the different types of ways that surgeons put implants in your breast, and the different types of breast lifts and reduction. And then implant size. Ooh, okay, actually, one thing I love talking about, implant size. So a lot of girls think, oh, I don't want to be really noticed and all of that stuff, and they want to go for like 200 cc's or even 300 cc's. I have seen some smaller frame girls have 500 cc's and it actually looks really good on them, and it doesn't look like huge boobs. So make sure, I would look at the implants. I would even talk to other girls who have different implant sizes so that you could get a good idea of your body frame with the implant size that you want, and then make a judgment from there based on the cc's that you want for your body frame. Not, sometimes 300 might be small, even 250 might be a smaller size for your body frame. So I definitely recommend looking at the implant size before you make a big judgment on what kind of implant you want. For example, I had one patient, she wanted a breast lift, no implants, and she ended up becoming super flat chested. And I was like, girl, just go get the 300 cc's. It'll be a nice little perk, it would fit you so well. She listened to my advice. She looks incredible. That being said, implant size, cc's, just look at other girls, try to get information. That'll best help you on what implants you want. Thanks for watching. Hope you enjoyed the content, and like, share, subscribe, hit the push notifications, and as always, have a beautiful birthday.